Today we are going to study about or learn about PDSA improvement cycle. So when you're working in any setting as a nurse practitioner, either it be an outpatient setting or an inpatient setting or an emergency room, there will be times when you think that um, what you want to achieve is not being achieved in a certain process or workflow. For example, let's say that you're in an outpatient setting and you have significant no-show rate, and you want to understand why there is so much no-show rate and how you could turn it around, then you can implement a PDSA cycle and try to see what changes can be, what can be found, and how you can improve the patient no-show rate. So it's an improvement cycle, which is structured framework used to drive continuous improvement process. It We start in a small scale testing, and then if you like the changes which has showing, then you implement at a broader scale. So there are four stages when in this process. One is plan stage. In the plan stage, you define a problem. In this case, let's say that no-show rate is the defined problem, and set clear goals. So how do you want to improve the no-show rate? Then next stage is do stage, where you implement the changes in a small scale and collect relevant data. In the study scale, you analyze the data and compare it to your original goals. Okay, when you were starting the process, what was your original goal? In the act stage, when you have the information, you either adapt it, adopt it, means like you like the changes and you feel like, okay, I can use this workflow change, and you adopt it totally, or you adapt it, means you tweak the changes, or you abandon it. So adopt, adapt, or abandon. So what I mean by that is, in the act stage, when it comes, you can act like this. So you implemented a plan, you defined a problem, you implemented a plan, you looked at the result, and when you're acting, you like it. You like the changes you see, so you take it 100%. Now you feel like, okay, I don't like all of it, but I like some of it, and then you change it and you adapt to it. So you change, modify, and then you accept it. In abandon, you feel like, okay, whatever you did not work out at all, then you abandon the plan. So applying the PDSA cycle in psychiatric clinics or in any setting will improve the process, like treatment adherence, patient education, care coordination, and things like that. So I think that, an example would be, again, patients are not attending follow-up appointments. Clinic staff decides to address this problem using the PDSA cycle. They identify the root causes, lack of reminders or improper scheduling practices. They set a goal of attendance rates by at least 25% improvement. During the due phase, they test a solution of automatic test reminders for a small subset of patients. And 2 weeks later, they gather data, discover while the attendance improved, some patients missed reminders due to outdated phone numbers. So, in using these insights in the study phase, the team refines their processes by verifying the contact details and offering call reminders. Finally, in the ACT phase, they roll out an improved system across the clinic, ensuring more patients benefit from it. Hope this explains. Thank you.